A very warm welcome to everyone who's joined the session. Hi, I'm Shivani Roy. I run the webinar program at LeadSquared. LeadSquared, as you know, is a marketing automation and CRM platform. So thanks so much for joining in, especially at a time like this when I know that not everyone's sitting at work, people are sitting from different places and still have managed to join in. So thanks so much. We really appreciate it. The thing we're talking about today is, of course, transforming customer experience in healthcare and health. It's all about healthcare now, really. So we'll be discussing how to optimize the customer experience for better engagement. Some of the things that we'll cover today are EMR adoption, how and why it's done, understanding the patient doctor ecosystem, tips to build an excellent customer experience in healthcare, and of course, improving the digital journey in healthcare. I have with me Linish from Docon. He heads the business and customer experience for two brands at Docon, actually. And he's also a strategy consultant to a stealth mode startup. So I'm very interested in knowing which startup that is. So Linish, thank you so much for joining us today. If you could please share a few lines about yourself, how you're doing, your experience with Docon, and then carry on with the session.
All right, thank you so much for that introduction, Shivani. Hello, everyone. I know these are unprecedented times that we are going through, but I'm glad that you guys have taken the time to join in. I'm Linish. I take care of customer experience, and that being my forte across Docon, and it's the couple of brands that I take care of here. I have, over the last year and a half, got the opportunity and the pleasure of interacting with so many professionals in healthcare, doctors, medical practitioners, healthcare marketing specialists, and it's given me a lot of idea and information about where we stand globally from an all digital healthcare system to how far the road is and how bumpy that road may be from where we are standing right now. So I'm here to share that and couple that with the forte of my experience in customer experience, putting that together, and showing hopefully the journey of the years to come in what India might take in the healthcare space. Right. So let's get. So I'll just give you a quick backdrop of how I'm just scheduling this talk. So one, we start off by giving you some of the external variables. I'll tell you where we stand currently, what are the challenges that we currently have. Then we move on to how we give a great customer experience within those challenges, and probably after time goes by and some of those challenges might go away, there are also other ways in which customer experiences keep getting better. And so we talk about that. We go on to the journey of how a digital healthcare would look like, and how much time we can probably see that in, and the future of the healthcare in India, where with a complete experience for all the people involved in this ecosystem. Right. So let's get started. First, as I said, some of the things that you will, it's good to know before we get into healthcare in general, where we stand. So it's important to understand in India the situation and the dynamic between public and private healthcare. 1 in 5 people in the urban cities choose private healthcare over public healthcare, and 1 in 4 in the rural areas do choose private healthcare over public healthcare. This being said, private healthcare is roughly 4 times more expensive than public healthcare. So in the road ahead, it's also very important to understand that it's not just adaptation through public healthcare. You'll also have to get the entire ecosystem of small clinics, polyclinics, and private hospitals to ensure that we have a complete digital experience in the healthcare space. Now, just a quick comparison between where India is in terms of spends on healthcare versus some of the other what I would call model nations at this point compared to where India stands. It's also important to understand it's not just how much the government spends on healthcare, it's also the GDP per capita. So if If you look at US, which has a huge economy, which is in no comparison to some of these other countries here, with a GDP per capita of roughly 60,000 US dollars, they spend 18% of that on healthcare. Canada, which stands at about 45,000 US dollars, GDP per capita, spends 11.6% on its healthcare. France, with about 39,000 US dollars GDP per capita, spends roughly close to 11%. And India, far behind in GDP per capita, which is closing in on 2,000 US dollars. It's not even comparable to some of these other nations, and spends only a fraction of that on its healthcare. So this, it goes well with the previous slide where I mentioned, where it's a lot of it is a lot of healthcare is dependent on private healthcare, not public healthcare, and this kind of recalibrates towards the same. Now, so this is one of the challenges for India. We don't have enough of investment going in there into healthcare, right? But that's not the only problem that we have. So if you look at what an EMR is, it's in simple layman terms, electronic medical records is a place where you absolutely want to make sure that all the data you capture about patients is stored digitally, with the aim that it can be used well, and also it's easy to access for all the parties involved. So with EMR adoption not as great in India at this point, and in fact there are critics who will still say that US is not there yet also, and they are far ahead of where India is at this point. So just now we just go over what India faces in the current day, the problems that they face towards EMR adoption. One, computer literacy. Now, this may not seem like a big hurdle at this point, considering all the people involved, especially the medical practitioners using it, are highly educated individuals. It's not just the medical practitioners, the doctors, the nurses using this. It's also a lot to do with the support staff around it, and also at the end, when an EMR has to become that sort of a digital healthcare journey for everyone involved, it also needs to be every person in the country needs to be computer literate, and that's something that India still has quite a way to go on, and that hurts the adaptation, because in this current day and age, especially if you have moved to a tier 2 or a tier 3 city, and you try to get a hospital or a clinic to use an EMR solution, as much as they see value in it, they believe that that investment is not really worth it, because their patients don't see the value, or they wouldn't, because they're not computer literate. So that's one of the hurdles that we face at this point of time. Two, there is no government regulation which mandates everyone to store data digitally, especially the doctor-patient data. And so again, there is no real push from even clinics, especially, which are run in smaller scale, and a lot of healthcare diagnostics as well as treatment happens in clinics in India, which is very different to some of the more developed nations in the world. We have that struggle as well, because there's no government mandate. This is something we expect the next 4 to 6 years or so to government to really kind of crack down and ask all medical data to be stored digitally. And that's going to be an exciting times in the healthcare space. The next is investment. There is not enough investment which comes in from the government, and there's not enough incentive or not enough motive for private adopters to do it as well, because the entire ecosystem is not built. So for that ecosystem to really start forming, the government's regulation needs to go hand in hand. And when the government regulation comes, the investment the government is ready to put in also comes with it. So that helps in building this ecosystem. So again, a little intertwined with the government regulation, but also I mentioned GDP per capita for this reason, where the investment has to be also a cost-effective solution, India being an extremely price-sensitive market. And the IT infrastructure. So if you're going to store medical data for every person in the country digitally, there is going to be a lot of investment needed in the IT infrastructure space for healthcare. And that's something we don't have right now as well, because at this point, for anyone to invest there is not worth that sort of investment at this point because they don't see when government regulations are going to come in. So just taking this ahead, another interesting observation. So these might be at the top of the bat. Everyone who might think of it, taking an entire country digital on healthcare will know that investment is going to be a problem, infrastructure is going to be a problem. You would need the government support, but there is something more unique to India. One of that is the number of patients a doctor sees a day. So according to the WHO's mandate, their ratio for the doctor to patient is 1:1,000, and India is not close to that yet. India is still has quite some way to go there. So on an average, an Indian doctor sees 40 to 60 patients a day, while a doctor in the US sees only about 20 patients a day. Now, the challenge here is because if you're going to capture information digitally, it involves you entering it into a system, be that a desktop, a laptop, a mobile device, or a tablet. The entry of that is more time taking than writing on a prescription pad. And when you're seeing more number of patients a day, that becomes a burden for a doctor. And that's one of the reasons why even after early adopters, doctors who are early adopters try this and give up in a few weeks and months. And that's simply because they're not able to manage both of this at the same time. Doctors also complain about the fact that if they're staring at the screen while entering the data, they don't have the connect with the patient where they get to look at them face to face and assure them that things will be better. So this is another unique thing to India. And so one other important thing to understand before we go ahead from a customer experience point of view is how many doctors do we have in this country? The latest statistics say somewhere close to 11.5 lakh doctors, allopathic doctors, and the doctor to patient ratio is 1 to about 1450. And the WHO recommended is 1:1,000. So there's some way to go there for India. And I think with the number of doctors that are going to come into the system, and probably we'll need more of those, that will also help the EMR adaptation with the current generation of doctors coming in who are more tech savvy, and they've been introduced to digital devices from a very early age. They are going to find this change from a more analog to a digital system much more easier, and that's what we hope. That will really drive forward a digital healthcare ecosystem in this country. So now let's jump to why we are here. What does it take to deliver great customer experience in healthcare? For starters, there is no real gold standard here because healthcare is still being explored in multiple silos, startups, huge organizations, multinational companies, all and also governments initiatives, and none of them there is really no gold standard. So how we approach it at Docon and myself personally is that irrespective of what industry you're in, you just make the journey seamless. And we work towards that, whether that's through technology, whether that's through a product, whether that's through the people who can support. All that has to all boil down to one single thing, and that's to make the journey seamless for the end user. And so that's what our entire customer experience is focused on here at Docon. So we'll get started of what's important to achieve this. First, the CRM tool, and this is why I really believe that a CRM is not given the importance that it's supposed to, especially in India and in a lot of startups also, where data is managed very in a scattered fashion. Now, a CRM is usually thought of as a tool where it's used for sales, it's used for marketing, and it's not used for customer experience per se. And especially, or at least after the sale is made, your CRM tools traditionally give great experiences through your purchase journey, and then after that, that's the end point for a CRM. How we have chosen to use our CRM, and that is LeadSquared, is where we actually involve everyone in the company, and this is a single source of truth for everyone. So everyone in this organization has a login to our CRM, no matter which department you're in, whether you're in product, you're in tech, you're in customer support, or you're a salesperson. All business leaders have access to this. The reason for that is simple. You just need to measure every touch point that you make with your customer. In this case, for us, it's doctors. And it's important because you need to have all those data points in one place. And if you have it in one place, it's going to be very easy for you to have a single source of truth and make sure that people use it well. Now, just a quick example of how this really helps. So when we get queries, or we have issues which are reported from doctors in case they are finding difficulty with something in the app, doctors, one, are always pressed for time because their time goes away in speaking to so many patients in a day, assuring them of the good times that are ahead in terms of how the recovery is going to be. They have very little time to actually get these things right. The reason they adopt technology, at least the early adopters, are because they believe that this will help the patients. And if as a company we don't do that well enough, I don't think we are solving any purpose for the doctor. So we take support very seriously, uh, and it's very annoying for a doctor if you call them right when they're sitting with a patient, or they're in between their OPD hours or on their rounds. So one data that we get from the doctors and basis their usage of the application of our EMR is we actually know what time is their OPD, and irrespective of what's mentioned on let's say a website or by them on their visiting cards, sometimes the OPDs extend, sometimes for certain doctors by half an hour, but certain doctors for even for a couple of hours. And so now we have accurate information of typically what time to what time a doctor practices, considering the delays that might come about. So we make sure we don't call the doctor during the time when they're in OPDs. And so that in itself is really helpful because a doctor is able to now spend a little more time to explain it. Is not under the pressure of someone sitting in front of me and I can't take this call right now. And that really helps in giving a great customer experience. And also it gives them the understanding that we are empathetic of the profession they're in, and how we take care of them going forward. So that's very important. This is just a very small example of how we use not just data which has been fed in by the a salesperson or a pre-sales person, but it's also data which we get from other sources, which we actually put back into LeadSquared, so that it's visible and it's a single place for everyone to come to know something about a particular doctor. And I believe that is a great strength that we have, which helps us in delivering great customer experience for the doctors in the EMR space. Second most important thing is to ensure that you take care of the data. And a doctor is responsible for the data of the patients, and it's an extremely private, privileged, and confidential information. And we take it very, very seriously to ensure that we don't use even a single byte of data for anything which is monetary, or even which might raise questions of why are we doing this. We absolutely have me or anyone in this company, all the way up to the founders, CEOs, have absolutely no access to a doctor's data, and it is protected in that way. There have been certain other companies who have chosen to use the rich database that they would have for monetary purposes, and they've not lasted very long in the market, and doctors also have frowned upon that. So we take data very seriously, and we assure our customers, which is our doctors, as well as the patients whose data that we have because of the nature of our business, that it's absolutely safe with us. And this is another great way to ensure that the experience is pure. and it's just between a doctor and a patient, and it's only facilitated by a company like Docon, and it's not mediated by them. And that's all the difference between customer experience and great customer experience. Um, Right. So in the current day and the place where we are, where EMR has not really caught on as much as we would like, and exciting times ahead, of course. Right now, the personal touch is still very possible, and giving great experience through individuals is still possible because the scale isn't as high. And so at this point, our strategy is ensuring that our whoever they speak to from our organization has an extremely simple way of communicating, are empathetic to the nature of work of the doctors and the medical practitioners, and and how their lifestyle completely depends upon their job. We have all staff that we have are multilingual. We speak 2 languages minimum, some speaking all the way up to 6 in support. And that helps in really connecting with the doctor in a language which is comfortable, and more importantly, connecting with support staff around the doctor, receptionists, nurses, in a way where we can really reach out to them in a simple and easy fashion rather than only sticking to English. And we absolutely don't compromise on talent. We have some of the the best people, and I'm very proud to say that we have some of the best people here, and they absolutely work really hard to make sure that the communication is delivered in the best way possible. And that uniformity across anyone who they reach out to within Docon really helps in giving a great customer experience back. But moving forward, this is not going to be reproducible on scale. And so that's what we are building internally right now, where every sort of communication that we do, every sort of learning that we have through the journey that we have taken in the past few years, we now not just solve problems, we preempt them, and then we aim to standardize the user experience from there. So this is in effect a 3-step process. One is, of course, there is learnings to go with it, and then we also preempt what are the kind of challenges that we're going to face in the times ahead. We identify a fix for that. We communicate that through currently our customer experience team. We ensure that the communication is yielding results. We measure that, and when we know that that is a viable solution, we move that into a way where it solves itself via technology, and so everyone on the platform is a benefit of that journey, and so the user experience gets standard. So as we go ahead, we are going to have more and more problems solved via technology rather than people in the back end helping and solving this as and when the need arises, or when a complaint comes in, so to speak. And this preempting has already begun in certain areas for us to understand if doctor is facing challenges in using the application. We are able to kind of preempt using certain parameters, and now we nudge the doctor even through the product of helping them with that journey of adopting a digital EMR platform for all their patients. So this is these are the 4 keys I would really say to ensure that we have a great customer experience in healthcare. Where the journey lies ahead is where I am personally very excited about of this taking shape. So as you would see, the first 2 bits, that is infrastructure and the government regulation, these would be the ones which have to come forward. But again, both of them kind of go hand in hand. So without government regulation, there's not going to be much improvement in infrastructure, and the infrastructure will only happen if government regulation comes in. So the government, these 2 will happen with a bit of government's push, with the investment coming in from the government, as well as then private players sensing the opportunity in this space, considering the amount of private healthcare practice in this country, and then will kind of take that journey ahead. So once data becomes digital, once people start adopting the digital and they're above that, we're on that curve which takes us to more and more adaptation, that's when we will have to ensure that all ancillary services come in and make this journey more seamless. So at the moment, we have uh, companies who work separately just to help you get an appointment with the doctor. There are companies which help you get online consultations, virtual consultations. There are companies which help you build EMR, EHR solutions. Uh, but there's no, of course, then there is other ancillary services like insurance, then there are labs. Now, all of them together is what we envision to be a seamless experience in healthcare for a doctor, for an end user or a patient or any medical practitioner or anyone in the ecosystem to really get benefit of this digital healthcare journey. And for that, you need to have interpolable data which flows between systems, which can be understood by multiple softwares, and then those all have to come together and be integrated. For the seamless flow of data is very important for a seamless user experience, and that's the journey ahead. And this, we are quite some way away from this, and this is going to be the exciting time where startups, huge organizations, governments will kind of synergize together to ensure that data is in a format which can be consumed by multiple systems, and then it's purely the differentiator between you and your competitor becomes the experience that you deliver, right? And so what the future might look like. The future, this I would give you with a disclaimer saying that this is a personal view of how I see healthcare panning out, basis the interactions I've had with healthcare professionals, with doctors, with some of the professionals who have worked in other countries, which really help to understand what part of the curve we are on and what kind of future we can really expect. And going forward, it's going to be one sort of way to get all your information in one place and then have that seamless experience to go forward. So I'll just quickly put this up. I believe this is going to be the interconnected network of things to really have that a digital healthcare with great experience. Now, worldwide, even with countries like Canada and USA having more than 80% adoption of the EMR, more than 50% do not integrate their laboratories into the EMR platform. And that in itself is a huge gap. And that would make a lot of sense for an end user and also for a doctor, when a test is advised and then the doctor is able to see the kind of the results that has come from the test without the patient really have to come again, carry the physical report, and then doctor has to recall why these tests were prescribed and then analyze, diagnose, and treat the patient. So this really talks about that. Now in India, uh, all of this is going to be linked by one common unique thing for every user, and that's going to be the Aadhaar. We've already had pilot programs which has been done in a hospital in Hyderabad, where a complete Aadhaar-based enrollment system was begun to be followed, where basically all you have to do is you give your consent and your fingerprint, and they use that Aadhaar number as your unique identifier going forward to when you're capturing an appointment, with the prescriptions that are generated against you, the medicines that were dispensed for your condition, and so on and so forth. And that would be the way forward. Of course, with Aadhaar and the implementation, the way it has been done, not being the most popular in this country, that's taken a bit of a backseat, but that is the way forward. The security measures on data will have to get stronger, and the government has worked on that. A bill is coming out shortly, which will really help the data protection of every citizen in this country, and that's when we can really expect these sort of seamless interactions and experiences to be possible. Now, a big part of this is going to be medical data. You have so much data which is generated, has to be secure. Again, the privacy of that and the infrastructure to that is going to be absolutely critical. Now, as a patient, you would still be able to do all of these things mentioned here. So let's say that you want to take an appointment, you want to maybe check some of the old prescriptions that were generated for your reference. Maybe you can't go for a physical consultation, you want to do a virtual consultation. Maybe you have claims you want to do against your insurance policy. You've given a blood sample for a test and you want to have a look at what the results are. Ultimately, all of this comes into one single platform. And this is where the government regulation is extremely important to ensure a standard data format, so that, irrespective of, let's say, whatever whichever clinic you go to, which might use a different company's EMR or EHR solution, it'll ultimately, all the data is readable across all of those, and that's going to be very important. Still, there are some unknowns here. One of that is how do you make the data flow seamlessly across these entities? So let's say if I, as a patient, and I have given my blood sample to the lab to test, does that mean I have also given consent for the doctor to view that report who has advised that that test? Now, that's a bit of a gray area at this point, because there's no rule really telling you that the patient or an individual has to give explicit expressed consent. That's where things get a little tricky. And this is where I think different companies might adopt different routes, and that will only be more and more scattered till the government comes in and tells you this is the standard. And which is why the government regulation is extremely important for the healthcare ecosystem. And the spends that the government plans to do will also need a bit of an increase, because with the current spend on healthcare and where India currently stands with its GDP per capita, this curve will take a long time to adopt. So our understanding and our estimation says it's going to take us about 4 to 6 years for the government to really come down with a digital healthcare, a real guideline and a roadmap for any player to follow. And that's going to be extremely important. Post that, from basis what we have seen in other countries, 12 to 15 years for us to adopt about 75% of all patients and maybe 90% of all doctors on a digitized EMR platform is going to till that takes shape. So we're about, give or take, 18-20 years away from this sort of a future where it's as simple as you having an app for everything about healthcare. And a lot of this will be shaped by how the government comes down on healthcare and how they plan and how they envision it. But this, I believe, is how I see healthcare going forward, in a very digital, in a truly digital sense. Now, it is when you have such interconnected networks, customer experience is not going to be dependent on an individual or a company's talent. It's going to be about the experience and the seamlessness that your technology, the product that you have built, is able to deliver for the end user. And that's going to be crucial going forward. So beyond the point, when you're going to work at scale, and especially when we have more than 1.3 billion people in this country, there is no limit to the kind of customer support or a customer success team, so to speak, that's going to be able to deliver that sort of quality of experience. It has to be solved via technology, and that's the way forward for healthcare in India. So just to quickly summarize as to where, how we began and what's really needed for customer experience. A CRM tool is extremely crucial to your success from a customer experience point of view. That has to be your single source of truth. You don't just have data entered there by your people in your company, but also other data which comes in through usage and statistics, which are put back into that for you to get a really clear understanding and have a single source of truth for everyone in your company to understand your customer perfectly, for you to give that great customer experience. You take data privacy very seriously, given the nature of the data and the number of number of data points that you're going to capture. It's absolutely important you build that trust with the doctor and the patient, and having their data absolutely secure and not using it for anything else. Customer communication, as I said, at a smaller scale, it's going to be how well you're able to solve problems for a doctor as and when they come up with those issues. And in a longer run, you preempt those problems, you identify fixes, and then you solve them via technology and product for that seamless experience and being that differentiating factor of your business, right? So that's about it from me. I have reached the end of what I wanted to speak about. I'll be happy to take some questions from the audience.
Thank you so much, Linish. That was a really, really nice presentation. I hope the audience enjoyed it as well. So, like he said, we're open to questions. If you have any questions now, please do share it on the question tab and we'll take them up. In the meantime, Linish, I will start with the first question. So, this is from Samir, and he says, so obviously, in terms of measuring, ensuring a seamless customer service, what sort of metrics should we look at?
Right. So I didn't speak about metric because it is subjective to the nature in which you choose to give your customer experience. Uh, CSAT is an extremely basic sanity metric that you should have. So where we stand right now with CSAT at Docon is 97% customer satisfaction for every interaction and touch point that a doctor has post a sale of a product. And that's extremely important and a very, very basic metric to have. The second, which I probably wouldn't call as a metric, more as a success factor, is to see the kind of referrals that go out. Doctors being a very tight-knit community, if they're really happy or if they're really unhappy, the word spreads very fast. So how quickly the word has spread is another extremely good example of how successful your customer experience has been, and that's something which really helps in understanding as well. The other thing I would say is important, uh, is ensuring that it's not just I know we make an EMR software and doctors are technically our clients, but patients also, we need to bring them in the fold to give them great experience. So which is why we measure CSAT for the end users as well, who have access to prescriptions that are generated through the platform of which a doctor has generated for them. We give them ways in which they can reach out to us so that we're able to give that great experience, which also helps the overall ecosystem, as it were. So being an EMR, of course, CSAT is something which is very basic in as a sanity thing. NPS is something you will need to take as well if you're trying to see how many problems your product is actually solving. But beyond this, I would say the way the word spreads, the referrals that you get, and also making sure that patients, doctors, the entire support staff there are all taken into the fold, and it's not just the doctor when you're an EMR provider. Those are absolutely essential to give a great customer experience.
Okay, I am moving on to Rajendra's question. And of course, Samir, if you have any follow-up questions, please do ask. Rajendra, here goes your question. He says, when do you think government will have guidelines in India similar to HIPAA in US? How safe is it to use data without such guidelines?
That's an extremely good question. So what we predict is that it's going to take about 4 to 6 years for the government to really come down with a proper uh, guidelines for not just data protection in general, but also very specific to healthcare. Data protection in general, there is already a bill which has come out in 2019, and in all probability within 2020 that should be tabled and it should be in motion. So in general, I think data protection is of paramount importance, and a lot of companies are taking it very seriously. uh, from what from what the government will do, or how tightly they will really implement that, it's anyone's guess right now. But I believe that this will come in, and 4 to 6 years time, we'll have extreme clarity of if you're a player in the healthcare space, there will be only one way to go about it. That being said, at this point, there are companies who use data rather liberally, and there are companies who are extremely strict about their data practices. We have bank grade security on all the data that we capture. And as I said, no one in our company, founders, CEOs included, don't have access to go and view any data of that order, of a particular patient, particular doctor, of anything for that matter. And I think at this point of time, it's extremely important to understand, as a company, be it a startup or a larger player, to really understand the stand that you're going to take on data protection of doctors, patients alike, and that's going to be extremely important. For now, till the regulation isn't formal and standard, it's going to be important from these fronts. It's up to the companies, for now at least, to really take care of the data.
All right. Rajendra, if you have any follow-up questions, please do ask. I'm moving to Vidhi's question. So Vidhi says, the hospital setup is extremely dynamic and it is tough to follow a standardized protocol to improve customer experience. How do we deal in such situations and stick to a standard protocol in case we have generated one?
As Hospitals are extremely complex, and there are so many departments and so many various operating practices for each one of these departments, and it might be very difficult to standardize. But and that's more because of the way it's set up. Every hospital has its own way, and on top of that, inside the hospital, every department has its own way, and that works fine. And it only struggles when you try to fit that into a digital map, and that's where uh, healthcare professionals find it extremely difficult to put technology in, because they believe it slows them down, or it actually ends up having bad customer experience rather than good ones. And that's a very valid question. I think the how to do this is you'll have to reimagine customer experience, and that's not by saying this is what we were doing now and we want the same thing to be done with technology. It's actually to take a step back and say that if I have to start now on how to give great customer experience, I would definitely have technology. Now how would I use that to my advantage? And that will this will need quite a bit of change management internally as well, and that will be challenging. You will have a bit of friction, but I think that's the only way to implement. And that's one of the reasons why EMR, not just in India, globally, is not adapted as well, is because people think that I just want to do the same thing what I'm doing now with technology. So I just, instead of doing it on paper, I want to do it on a computer. It's not as simple as that, because there are a lot of restrictions in either one, and so you're trying to find the sweet spot in between them. And I think you'll have to look at it from a fresh perspective of how do I use technology to give a great customer experience, rather than I want to give customer experience by just adding a new software. And that reimagination is what's going to help you really deliver a great customer experience.
Okay, I am moving to Mohan's question now. So he says that, of course, ensuring a great customer experience is important, but he finds it hard to generate customer feedback. So do you know any can you suggest any ways wherein they can get customer feedback more promptly, or if it's if you can suggest ways on how to do it better rather.
All right. So to answer this question, I would need a little bit more context. Are you, but I'll just answer it from a bird's eye view, and then maybe this actually warrants for actually a rather long and more intricate discussion. But just from on the top, if you're looking at your customers as someone who has purchased or is taken licenses to your software, and then are using your product and you want feedback, it shouldn't be that hard to get, considering they have vested interest in you developing further. And so it's only rather important at what time do you get feedback. There are biased ways in which you can do it. If you have solved a problem or you've rectified something and you ask for feedback right after, you're bound to get a more positive feedback. If you have chosen to ask that at an extremely random point, you're most likely not going to get a response. You're only going to get response from people who are extremely happy or extremely annoyed. And so that really skews your metric altogether. So what I follow as practice is at the scale that we are in, especially in healthcare, you can still communicate, and you random sample, you communicate, and then have a very open texted feedback which you collect. You also send out you send out periodic questionnaires for NPS and other things anyway, and you're going to get responses from there. You can actually reach out to them to understand in greater detail, and it doesn't become a job of customer experience or marketing people to only do this. I think anyone in the company, if they listen to that conversation, they're going to derive different insights out of it, and they're going to solve that or think about solving that differently. So it's a very inclusive process within a firm or a hospital for you to have people from all various specialities who have their different specialities to come in and then think about how you solve that problem. So this shouldn't be too difficult. But however, if you're talking about if you're a B2C sort of an entity where you're trying to see that anyone who has registered as a user who are not necessarily paid customers, and you're trying to get feedback out of them, then you'll have to adopt the traditional B2C techniques where you time your surveys on SMSs or emails which goes out. You time them according to the time when you have maximum click-through rate, and then you follow that through by getting a large enough sample for you to conclusively say either way. But this is a very interesting question, and I'd like to actually know the context of this. So if there's anything I can really help with, I can do that. I would I'd ask for you to connect with me so that maybe I can help you out with this.
Sure, Mohan, do connect with Linish and elaborate on your question. In the meantime, I will move on to Ashish's question. It's another one on data. So he says, what will be the impact if any data breach took place? How secure is it? And what about accessibility, in brackets, mobility?
Right. So I'll start with mobility first. Mobility is not the hardest to achieve at this point, considering the number of handheld devices we have in this country. With app or mobile web, it's a very easy way to give accessibility to everyone. How safe is the data? It's as safe as any bank and all the banking information that you have. We use the same sort of encryption, and I believe that has kind of become a standard for a lot of companies which have data in the volumes, especially product and technology companies. I don't think anyone's going below a 128-bit encryption, and so that is as hard as it to break into bank-related information. It is going to be as hard to break in here. Now, breaches, yes, it's something that everyone in the technology space is worried about, and we take a lot of precaution to ensure that that doesn't happen. Now, that again, since there are no standards set as either by the government or any governing body, some companies do it better than others. Some industries do it better than others, and it's also boils down a lot to how the culture is. to really say if we're going to do everything in our power to take care of data, or is that not not as important as, let's say, market, how much percent of the market you're capturing, how much sales you're making. So I think that's very, at this point, it because it's not regulated, it's very subjective to how a company sees it. But we take this very seriously. So there is, as I said, no one has access even internally for us. Even if I wanted to access it, even to view, I really can't. So data breaches are is very difficult in our systems. But then again, not every company is able to invest as well this much for the security aspect, and that's a very, very important piece.
Yes, and I can see that the data breach has sort of is the majority that people are asking about. So Dr. Amit is saying that he has started using EMR on cardiology practice, and he has more than a lakh of data, network of over 40 heart clinics across Indian villages, and he'd like to know more about it. So I am assuming Dr. Amit will get in touch with you, Linish, on
Absolutely, looking
this.
forward to that.
Yeah, and then Nishant, yes, of course. I see that you've come in late, but don't worry, you will get the full recording and PPT. Okay, so Dr. Amit has even shared his number. So I will share that with you, Linish, privately
Sure.
after this session.
Absolutely.
Um, so I'm moving on to the next question. Linish, can you please share some examples of other healthcare businesses doing, having a really good customer experience in place, just having it extremely seamless?
So we're not, to be very honest, we're not there yet. We have examples of bits of healthcare being done well. Let's say if it is, you're looking to buy medicines online, right? And there are companies who solve that well. Who, if you have a chronic condition, you can practically order everything every month, and the orders keep getting placed by itself. You make sure you never miss a medicine. It also reminds you that, have you taken your meds. So again, in different silos, there have been companies who solve it well. There is no company right now which solves all of it together, because there is no ecosystem at this point. So the ecosystem that I spoke about is what I envision, and my understanding of how things are going to shape up. And then together you will have one player who does all of those things, and then there will be competitors of those as well. And that is where I believe customer experience really becomes your differentiating factor. So right now, whether you want to take an appointment, there might be one platform better than the other. A doctor wants to use an EMR, there might be one platform better than the other. But there is no complete ecosystem at this point. So only when it all comes together is when we can really say that there is one person doing it well. But at this point, it's all in silos, and eventually I think this will consolidate, and then it'll become a standard sort of a practice.
Okay, I am moving to Shubham's question. I'm not sure if it's a question or a comment, but I'll let you be the judge of that, Linish. So she says in B2C entities, the customers are sometimes unaware of the benefits that a better system can bring. In plain words, customers tend to stick to traditional systems and are less experimental when their health is in picture. How to make people realize the benefits of a better customer experience when the traction is so less?
So that's actually an extremely good question. So at this point, yes, the traction is less, and I wouldn't really comment on saying customers aren't as experimental at this point. I think that's because of the lack of options or a unified integrated solution that they have. We see them really, customers venturing in other industries, they have really taken that step to uh, uh, you know to try out new things. So it's only a matter of time before we get there in healthcare. Uh, Now, you mentioned that customers don't sometimes get to see all the benefits. That's absolutely true. Our communication at this point, whether it's a marketing communication or it's the reach, don't have the money to really invest in that at this point, because everyone's working on making their foundations. So this is where I think collectively, when with the amount of private healthcare practice and the government's regulation coming in, we actually the goalpost will be moved to what the experience should be like. And I think that's when customers will start looking elsewhere to see, okay, which of this is really worth it for me. At this point, even if they adopt something digital, let's say, let's say for taking appointments or for buying medicines, those systems don't talk to each other. You still have to, if you're going to buy medicine for a condition, you still have to upload a prescription. And if that prescription is handwritten, you have to click a photo and send it. So there's a lot of friction in all these points, which stops a customer from really adopting something and saying that, this solves a problem for me. These problems are being solved right now in silos. When the goalpost is moved towards a more integrated ecosystem for healthcare, that's when customers are going to be more experimental in trying these things and trying new apps.
All right. So I believe Nishant has a question for the audience itself. Nishant, just bear with us because it is almost close to time. So I'm not sure how many people can still answer, but I'll ask it aloud anyway. So Nishant says, I wanted to ask the other attendees, have they faced a drop in their traffic? So to everyone else who's joined, please let us know if you faced a drop in traffic. Now I'll just quickly sift through the other questions or comments that have come in. So Ashish says, I think if data is analyzed anonymously, we can take more accurate decisions regarding infrastructural changes in the field of healthcare. Views, please do not take it otherwise. I too respect privacy. Linish, if you have any thoughts on that, or I will just move to the next question, which is from Dr. Amit. Says, I can add to that question. Answer to that is okay. So he's responding to one of the questions. He says, we at our hospital give them the service which is way ahead in comparative with other hospital and go an extra mile in our service. Okay, that's great to hear. I do not see any new questions coming in. If you guys have any comments on if you faced a drop in traffic, do let us know. But I do understand we're close to time, so you might just be wrapping up. Nishant, not Nishant, Vishwesh, yes, you want a demo. Yes, we will get in touch with you. And so, okay, Dr. Amit has responded. He says, yes, we have a drop in traffic. We are using digital methods. Our digital route traffic has increased. And Shubham says, our market research shows that there is a drop for the new players, but the older ones are seeing a spike due to stronghold and trust issues. Okay, so Nishant, I hope you have some clarity there. Linish, if you want to add to that.
Just one quick thing, I'll just take a minute. So there was a point about anonymized data and how that can really help infrastructure. Though I think in order to get to a point where you have enough data to anonymize and then take a decision, I think you will need the infrastructure. So I think it happens the other way around. But just to explain let's say if we were 20 years into the future and if we had a system like what I imagine, a situation like COVID-19, the government will all but have to click a button for them to see how many cases are being suspected, reported, confirmed, tested positive, tested negative, and then they can just mobilize teams according to that. And that's the power of having a network, an ecosystem, and then using the data in a very anonymous fashion, and then the government being the judge of using that data accurately. I think that would be probably the best sort of example to give relevant to this current situation, where if you have anonymized data, what you can possibly do, and then you could really, if you kind of think from there, you'll realize the possibilities of healthcare experiences are endless. And I'll just like to end on that note.
Okay, great. Uh, there are more questions. Okay, there's the last one. Last one coming in. Again, just okay. So he says, I guess the answer to the last question proposed was that the customer really needs to be educated and needs to be instilled with the faith as opposed to the perception of being duped by medical experts. That's the key differentiator. Okay, so my bad. It was a response to one of the questions. I don't see anything more coming in. Linish, thank you so much for a really, really great session. And I can tell the audience liked it as well. We got so many questions, and it was a really interactive one. Thanks so much for giving us your time.
Thanks so much, Shivani, and thanks for the opportunity. Thanks for everyone tuning in. If there's anything you would like to discuss further, I think you guys can connect with me, and then we'll look forward to that.
Absolutely, and we hope to have you back again, Linish. We really hope to have you back. For
Sure.
those of you asking for the deck, we will definitely send it out to you, as will we send out the recording, because I see quite a few have asked for that. Thanks so much again to everyone who's joined the session. Thank you for giving us your time. I'm going to end the session now. Take care. Bye bye.
All right. Thank you. Bye.